We're here at the Aspen Idea Festival today. Very excited to share some conversations about artificial intelligence, about augmented reality. And so Dr. Bederson, I have a few questions here that I would like to ask you. And the first question is, could you please tell us in your surgeries, how is artificial intelligence and or AR and VR helping in performing the surgeries?
Well, AR or augmented reality and VR virtual reality are used every day, not just in the operating room. You could actually believe me, I'm sure you believe me if you understand that putting on a pair of glasses is like augmented reality, because we're amplifying and magnifying what is already out there. The term augmented reality in neurosurgery, however, came into being when we started applying computers to improve what we can do and what we can see. So what we do now is, through the use of computers, generate an image based on the scans of a patient. We'll combine many scans, an MRI, CT, angiogram, different sequences of the MRI, and we will construct a virtual reality scenario. Think of the movie Avatar, in which we've overlapped all of those different image modalities and created a virtual world depicting the very accurate anatomy of the structures and functions of the brain. We can then take portions of that virtual reality scenario, select them, and then overlay them into my eyeglasses, but my eyeglasses in surgery are an operating microscope, so that when I look through the microscope, I see not only the brain reflected in the bright white light, but I also see part of that VR scenario injected into the eyepieces and overlaid, perfectly matched with the patient's anatomy. I can adjust the transparency of the tissues that I see so that I can look through the brain, if you will, all the way ahead to the tumor or to critical structures like a blood vessel or critical cranial nerves. This has become very helpful in safely operating on my patients.
So it sounds like it's like a video game, enhanced video game, but you just mentioned something in your last sentence saying that this is possibly augmenting the safety of our patients. Could you elaborate on that a little bit?
Yeah. In the past, of course, you still need to avoid all the important structures and remove the tumor if it's a tumor. And we had maps of the brain, and we had accurate scans. But what was needed was to stop the operation, go look at a map that might be in a computer screen off to the side, and then start the operation again. And this constant diversion of your attention from what you're actually doing to what you're, the map you're going to study actually distracts you from what you're doing. Now, if you're holding a drill that's spinning at 65,000 RPM, and you're in very delicate territory, it can be dangerous at times to stop what you're doing, look away, and have to look again at what you're doing. So this, in my view, has improved the safety, the speed, and the accuracy of my surgeries.
Yeah, so I think you're describing a lot of benefits for the surgeon, because your surgeries are facilitated by the technology. We also like to emphasize outcomes. In your own patients, could you tell us examples of where you saw AR, VR really having an impact on outcome?
There's probably not a day in the operating room that goes by that I don't see the direct benefit to my patient. I can't tell you how many times I've been operating towards the deep end of a tumor, and the VR has shown me where the carotid artery, the optic nerve are just beneath it. So in virtually every case, I feel there's a benefit in safety for the patient.
And so this brings me to the next topic that we wanted to cover, and that is the brain-computer interface, the BCI. So here we're looking at computers not just to augment what we do and to improve the outcomes of our patients, but also to create something that doesn't exist. Is there perhaps a better definition of BCI that you can share with us?
Yeah. It's a great question. Of course, anytime we use a computer to help us in the brain of a patient, that's a form of a brain-computer interface. Over the past 10 years or so, the term has really changed though, with a focus on interpreting the signals of the brain, the electrical signals of the brain, with the use of a computer, and then taking that interpretation and doing something with it. As an example, in the most interesting use of motor BCI, a patient who's paralyzed will have an electrode placed on or near the brain tissue that normally would function to control the leg, let's say. The patient will imagine that they're going to kick their leg and intend or attempt to kick their leg. That will activate the electrodes in the brain. That'll be fed to a computer, and that computer will then do something in the real world. In the case of Synchron, that can be used to control a computer mouse. So a patient who cannot move at all, by thinking, maybe thinking about moving his leg, can move a mouse and click on a letter on an iPhone. So you mentioned before the use of iPhones. BCI can now be used in paralyzed patients to control an iPhone.
And so where do you see the field going? So right now, you said just by thinking about pressing a button on the computer, on the cell phone, the computer can actually do that for you. Is this where we're at, or you see this technology potentially moving forward, and in which direction?
We are actually there right now, so that's being done now, actively being done in patients, some of whom have been implanted at Mount Sinai. The next phase of this goes far beyond that. With the newest generation of electrodes, we have 1,000 or 2,000, or in one case that I did, 4,000 electrodes on the cortical surface, able to interpret many more parts of the cortical surface activity, such as the movement of individual fingers. So in the very near-term future, I see BCI able to control prosthetic devices like a robotic arm, but also hopefully able to feel the movement of that arm so the patient has a much more engaged sense of what they're doing with the prosthesis. Beyond that, the applications go to speech, vision, hearing, disorders of movement, epilepsy, and the list continues. So I think we're really getting towards a future of very exciting possibilities in brain-computer interface.
This is really exciting, and it sounds to me that one thing that probably needs to be emphasized is the team effort that you lead, because neurosurgeons are just one of the team members in this BCI. Could you elaborate on the team that you surround yourself with, of all people that are very crucial for this technology to succeed?
Thank you for asking that. At Mount Sinai, we're fortunate to have the world's leading neuroscientists. All of this effort is dependent on a massively successful enterprise of neurologists, neurosurgeons, neuroscientists, psychiatry, physical therapists, geneticists, pathologists. The list goes on. It is an integrated effort, and one that I hope we will expand greatly in the future. Something that's very interesting and very important to me is our decision to hold the first brain-computer interface symposium in New York on November 1st and 2nd of 2024. We have invited the world's experts in this area to come and spend 2 days with us, focusing on everything from neural decoding to the regulatory environment, to ethics, to commercialization, and scaling this process up to the highest levels. We think this is going to be an annual event, and one that should have a big influence on the BCI world. I hope you can join us.
Thank you. This was really great and inspirational.